pleasure to be on the seat on Saturday. The name is Abigail Ashley. Mobotomuyana. It was said, and Yakupa say, I depart ye, Bium, the Biamicas and you Bian and Yanisao. I decided Pachua. Necessary that Yamiasi, Anano, Asem, will be firm, kidney for Muda Kolebu Teaching Hospital. Ow, Mobo, it was ya, I did Pacho. Now, sorry, now to make a Johnson. Now, when Danya Miasia, hey, why are home? 2 weeks near. Ya took Kolebu dialysis unit. Now, where Bisa who say, or more Moko dialysis no more yedden. Well, wuni sika uba kotia for dialysis on. I just say waka wa no. We need extra money because private ones need charge 600, and I call it charge for 419, and no more for 2 weeks. So just imagine. Meanwhile, in the month of June, you're promising a free dialysis till December, and I'm a bizarre call it penny phone say. And to move patches free dialysis now, Dr. Paomiaka, and the friend is saying National Health Insurance Authority for kind some more patients need free no. I could say almost me pacho sister. Kolebu, Yan start say it's been 2 months already. Yes, someone yan start say me nko ho crebium. Now with me patches say oh sorry. Now who so Danyamia say why? And son said Johnson now Johnson free no. And you beer and Eko Johnson sa obi da machine so enti na okọ dialysis no obi da machine so ansa na Johnson no watumi a Johnson enti wotumi Johnson free a danyame ase why As usual the motivational message kakra bi be bra mu ye wia ene table no so I am too much and by be make sure say be ni kakra kakra ye be ko US abasesia ye ne aba Sister Helena Nanama Akonoba Bekasa, CEO of Akonoba Foundation. She's into mental health advocate. Ye bisa question be social media ni mental health. Sister, what dream hon? Say the prank for. What dream one na? And no come ye bebo. Ye wia. On say paste na ma wo si bright pa no. Aha, ye be ra kojak for office on mo. Ye ni omo so be bon komo. Omo mouth bath no omo paste no omo ndro omo ye eni dia Ghana for ensure enim e wo hono ye nyom ba ko bonko ye wia main discussion for the day no and din kakraka neurosyphilis neurosyphilis Dr. Owusu Ansah or a medical practitioner and a CEO of Healthy Soul Medical Center no so agina konya da on also tia and to me guess ni I ready Helena wa line no so so na me bra pini hey PRO papa PRO me catch the boss so betimi aton no kra ai Mr. Frank Osiahene ono so e wo ha oye Kojak PRO for Accra branch ono so ye ne ba ko bonkomo afa Kojak products en ho enti we ma me too far me studio how enso me too far e kwa kora US me buses here enti mu da mo ntwem na me ntwam. Hello Sister Helena.
Hello.
If you are waiting, my wakaba.
Oh, that's it. Thank you so much.
Adiachi, baby.
Oh, Adiachi. It's actually 10:05 now. So Adiachi.
Okay. 10:05, and I hire about 2. Okay. Okay. All right, no problem. You're friend and you're bonny. We know you are championing mental health and you are a mental health advocate. And you're also the CEO of Akonoba Foundation. We did you not the Abagana, but saying, yeah, that's in your show. Yeah, that's in your show. It was our quite panels because Obi or Hodgia or no be dinner, dear. Nas wood, Jana, what car baby are free. Now what they are Ghana for. But and that question, yes, social media ma nkrofo pressure kosro more depression more falling into anxiety ni nyama na we de wo de kakra obeka fa ho na afa yaba wo upcoming events no ho
Mpashe yo. Wait a minute, I was say. So my me akunya no. Met share with you for na. Na ma share okay from na. And everyone that is actually helping you bring this, to where it is today, with the better I say. And it's a question, idea because that's what's going on, social media and mental health, it's something that I think that hustle, and people are not really understanding why, because social media nakasa wo negative and it's now positive, right?
Yeah.
On the social media, it sounds so maybe when we see those things that we're like, oh my God, what is going on? Like, especially my TikTok, an example, right?
Yeah.
There's a lot of things happening with Chrome Hanoma. Again, fun to say, even if you want to, you go to TikTok, it's there. How to do it is there. It got to a point that.
So real be a TikTok show say the Riani no.
Yeah, to say the other so called to be can be approach Hanoma.
Okay.
Over TikTok. Now what everyone say go to my Kia. If you how to Uber Kia. And I say YouTube crowd call. That's a what type here, right? It will give you how to do it, right? So it's a negative and of course positive, right? It got to a point that people were actually like kids here were actually committing suicide at TikTok. Like how to do those things. When you Google it, when you look for it, TikTok was actually giving you like a visual part of it, right? But then if you Google and it will actually give you an idea of how to do it, but it's not really giving you, the visual or whatever. But people are actually taking that TikTok platform to actually do these things. So now let me just not take that back to what we're talking about. It has positive and negative, right?
Okay.
Money negative near content, right? Content, being illegal acts, right? Self-harming, eating disorders, like increasing mental health risks, right? Everyone also, so I would say interactions that people have on social media when it comes to mental health, a lot of people focus too much on interactions, like with the content that you share, to say, whatever we're sharing, you don't know that it's impacting someone's life negatively and it's impacting someone's life positively. We have no idea, right? Even filters now, you picture pictures now. Almost filters now. You have the Snapchat, those things also. It has both positive and negative, right?
Just I don't know, sister, they be an smooth. Another problem.
Exactly. It has both negative and positive because when you cramp, when you say, who's a filters, maybe it's my old looky, like whatever. So people that have low self-esteem will always want to use filters because they feel they don't look good. They don't feel that they don't look that great. And so they would love to do that. So social media is really not a bad thing. But it's more of like what people are showing out there. And some are and you to me more them cause oh my God, what am I doing? Not money panel look back. So what I say, maybe this kaka make on social media, and I'm not really gonna condemn that when it comes to it because will be super, will be when it comes to mental health, will be to say be I'll be to see I'll say oh nana man kasa or mami konko tie na mi tia some papa. You see, it's ways of how it helps. But obviously we see me kasa twice and if you can say oh then I'll bash and it's all about that. Okay. But I want to say you're focusing more on the positive more than the negative.
But how would you differentiate? How would you differentiate the positive from the negative? Because your friend is still busy say, Dan Kwekuye Boase, he like cracking jokes. And so some people like to listen to him on social media to take off their depression and take off what I say, not a monster, more pressure, above from. Or be so or sorry, ni photos. Ni cars, ni bibi obi shares, Miss Minye, at this age, no walk away, then no some one your depression. And let's talk about depression.
I mean, I thought I was tired. I don't like tired, so but because of the cool ones, you know, you have a lot packed with it.
Yeah.
If I did that commission, that hey, we have to really sit and really talk about these things.
Okay.
And Satia, and Satia, when you Obi dear Bano, Obi dear Berry, Obi dear Berry. What is the rush? There's always time, as people say. Memory, when I am a woman, right? Just I will show be dear, and I will show be a sawasa, and you will fail. Because you're sure be and BB. Yes, we have role models. I want to be like this person. I want to be like this person. Utimuno, there's no obsession. Utimuno is like I'm working towards the goal to get to this point. And I to be like this person. And I said, yeah, Nipana Cynthia your kind of role model, no. But it has nothing to do with obsession. It becomes bad. It becomes bad when there's obsession. When there's jealousy, I want to be like that, right? So then I will come on. People will watch Dan Kokia like if you're BB or you know, be very stressed. So if you want me to say, but obviously today, you know, can say, oh, if you are all kind of one in the way of like I'm saying, if you have to job, if you any father can want some.
Exactly.
It's what Diana said. Dwell on the positivity. Dwell on the positivity. That's all I tell people because negativity.
Okay.
But how I will be to me, I can say no. Let this positive no overcome negative no. And no, I am in here. But I'm not saying they're easy to do. Abi. Because social media they say wrong. Obi wa how are you so addicted? And no piano. It was in life now it's about social media. Obi wa how no mo so no pa. Do you say camera is on that person? Ultra media, social media. You know, it has become part of us. But if you also soon, start to release whatever that you're going through, maybe depression or whatever. Like if you have anxiety problems, you have whatever, it's helping you to cope with sad, you know. But it'll be a hunasa. It is all you'll be at. They say you like social media. It's not bad. It's really not bad because if you should start as an escape to whatever or it's the only thing is to take a break, kaka. So what I say. And I baby now you feel sad they were more me patch or anything at Facebook and then you won't follow me unfollow me just for your mental health. Unfollow, yes, because that person is not, contributing anything to you. Okay. So you want to be like, okay, I'm not getting anything out of it. Let me just unfollow. So I say, and I say, if you are setting limits. If you are social media, and I know people want to be on. Sometimes you go TikTok, I'm seeing Ghana for it's so you're sweaty. So I'm like, these people don't sleep. You know, you're sweaty. So either you game, you can be, yes, they don't sleep. But you have to set limits when you use social media.
Okay.
Instead of you call that when you say, let me turn it off. Turn it off. Do this, turn it off. But a lot of people don't know these things. So I say, it's when you're doing, it will have negative.
So in short, what you are saying is it's not everything that we have to absorb on the social media. We have to be selective. The things that will give us positive impact, negative impact in bungu.
Yes. Okay. Yes, that's all you can do. Okay. Because that's all you can do. That's all you can do. Yeah.
Okay. I could have answered our economy part show. I hear there is an upcoming event, which is for the mental health advocacy program. Can you tell us a little bit about it? Yeah.
Oh, and thank you so much for giving me this platform as well again. So we are, this is our very first time, Akonoba Foundation and I day mental health advocacy as a theme because your community now mental health and degree. A lot of people think that it's stigmatization and that's what people hopefully say you're labeling that person, right? And and I say we came up with this and said there's been a couple of incidents happening here in New York, right? I'm trying to say a lady, I'm going to use that as an example. She was going through a lot, right? She was depressed. Or 5-year-olds, right? Or she was so depressed that mental health professionals went to the home to see Nkwalano. But as social workers and mental health professionals. So what we do is that when we go to a home, we observe. We don't just come for one person. We observe everything. So based on observations, they realized that, oh, that mom needed, a mental health professional, go seek someone, go to therapy, do what you need to do. We did advise this person, and she did not take it. So I said, and they say she actually twins, 5-year-olds.
Wow.
Yes, or try it, or we no try another thing, and I feel in Kwalani no, on where we no checking in, Uncle Fan the same thing, her mental health. She's depressed, because depression can lead to suicidal ideation. Depression can lead to a lot of things. Her self-harm, it can lead to a lot of things. Into joy, and into sa ade where they are too young, so no. Your per se, your community, not just African community. A lot of people are so in denial when it comes to mental health. We just want them to know that we're here to advocate for them, because you need to learn how to advocate for yourself. The fact that you're going to seek professional help, the fact that you're going out there just to talk to someone one-on-one doesn't mean that you have issues.
Okay.
And that doesn't mean to sebio, you come for it's an annual gala. Not just that. It's an annual gala where people can come, it's an open bar, they're gonna come eat, they're gonna come and also psychoeducate. Almost about the psychoeducate, because we're bringing mental health professionals, licensed clinical social workers, we're bringing a friend to say people there just to give them a little boost, a little talk, something to kind of self motivate them to be able to get these things when the need arises. And just to help them. I said this is what it is. The facts are one, because Abby over the may you will be.
Chief psychiatrist no what Ghana hano or waka or see a mental health no be will be a bit yet is a teaspoon. Mimi then say a teaspoon and a what tablespoon. And I wa a fry tray no dear no, and I wa a quantreno, and a mom we are dancing no we yum hunenam street no so. But me then a teaspoon then. Is that whether you like it or not? We all have mental health problems. So for us, you always sometimes get annoyed when someone is talking to you. You have a mental health problem.
I mean, again, if we want to if we have to go in that, then because that's how I mean that. September 14th.
Okay.
September 14th.
All right.
September 14th. Now, at least your vision and I say your goal and casa for this, and say, me need to Ghana wash that. You need therapeutic center. Because okay. You need therapeutic center. And it said, you be on nam kwino so nam wa waro no ho che se bia wa bodamu obi wo kra na obi keke ni obi abonkomo nso wonye bi so what I say. So Akoro Foundation the ye need to idea and what we want to do is that we want to help build a therapeutic center. It will be BIAC. Said the Beya and Lukwan is going to help the youth get jobs. It's going to help people say, okay, when I need this help, let me go here to talk to someone. So that is so now we still want to create that awareness. So please, if you need someone to talk to, you feel like you can't trust nobody, like talk to a professional.
Okay.
That's your pound. That's your goal with this guy. I mean, whoever that's listening, yes, we are selling tickets because that's a way of us also getting the funds to be able to do what we need to do. If we are selling, we're selling the ticket. Open bar, that be you've been here, you know how it is. Open bar is not just easy. It involves a lot. Food involves a lot. And of course, even these people coming out there to talk to us also involves a lot. If we want to take this ticket, it's not at a from CAGC, but it's like you're helping support the cause.
Exactly.
That's all. That's all.
And very, very necessary. Akonoba, before you leave, is there any social media handle, any WhatsApp group, any contacts? Just in case someone needs someone to talk to. Obeka Sagana had the new Bikokasa, depending the back of So is there any number that someone needs someone to talk to, the person can call, or any WhatsApp he can text, or any social media he can just connect to?
Sure. The show Facebook, the Akonaba Foundation. Now you can just go message us. We will definitely get back to you.
Okay.
And I said, me war. Miami dear, and I'm Akonaba official on Facebook as well. And also, so waiting there are people that reach out to me most. Well, Nanama Akonaba official when they're going through stuff, and then we talk. I call them, we talk. I Facebook, TikTok, so Akonaba Foundation, Samsung, Nanama Akonaba, and so number I work Ghana and no the ofra and no crown I will be able to talk to you, and no there is 0533 732 838 0533 732 838 number is with me. If you call, I miss a call, I come back, I will definitely give you a call. If you need someone to talk to, you need share what drink, you can't really trust anyone, you can definitely reach out, and then the team and I will definitely help you. Yeah.
Madam Helena Nanama Akonaba, you better was say, and I mean, so person can be answer my Indiana.
Before I'm a con, not me quite like I think I'm starting and me can't. But my father is one at the team in Ghana, and they are doing an amazing job. Fidelity Praise Arena Astorewa Blikuma. A prophet Noayabua has been very supportive and make me father so at Dana Sepa any team because they've been amazing. Right. And also America has soldiers in New York team and also our Mohano Linda Ejakwa Ene Esther Araba Mensa, and other team, Rachel, Mary, because my good is Zamansky, they've been amazing.
Yes, Jagana Muka say you've been amazing. I mean, the mere that you have this vision and all you could think about is the mental health of the people in Ghana. We thank you so much for that. We really appreciate you. Keep being you and keep doing your best. We'll keep talking to you before the 14th of September. We are very sure we'll call you again before the 14th of September. And say we are ready, me pacho.
Thank you so much. Thank you so much for having me. Thank you.
Me babucho ye ni yenuaba Nanama Akonaba ene kasaye CEO for Akonaba Foundation dia into mental health advocacy me pedio ye no me ni je ho oboaboa nyama nanu e we breche ho a no de abagana abeboa ye nuanom Ghana for, and this time around they're trying to set up a facility. All they're going to do is to give mental health advice to people, anybody that works in there. But meanwhile, instead of my social media handles, and if you have any problem, you want to talk to her, you can reach her through that contact. Makanya say na me table no so edos pines. Me my brain crying to me request studio B. Mr. Frank Osia Hene, PRO Kojak Farmer. Studio ha da. No your bar. Samina na when you try the picture. Or shishanya mana ne boss credit channel ni aje ho. Ai. Or to me makacha the boss say or no obet to me out on pa or no obet to me Mr. Sia ne bet to me out on. Mr. Sia ne yama akwaba. Bibia boko de. Bibia boko.
Bibia fine pa.
Bibia fine. Yeda nyamias say the pa achi biom. Amayenkwan obayen so be parking yama as usual. And let me to me who mouth bath no what table no so. Yen start to hono mo. Okay.
Ye tiane say Kojak farmer de dodo na enimu ye fit ne nimu say Kojak de ye ba ye de pa na eba. Na before so ayeba no na ye research yi Ansah na yetimi de bibia babonten. Enti wenimu nyina no na bi wo hodada nanso Kojak efa chire bisa se ne ye hodada no eden pa na munya ya anka ebesesem anasa den pa na munya ya anka de beka ho eno nti Kojak ehu saa ne man tietie saa nsensem no nyina no na ya ye bibia eye mouthwash na eno no ye wo mumienu ye wo Kojak P ne ma ene ne mouthwash ene ye wo Kojak F ene ne mouthwash ni nyina no ade a eye aduru a yetimi di yenum ni anase yetimi ma yenum enya hoden na ye ma yenum apomudin esipisita ye ka yenum a ye wo ese ye wo techrema ye wo ese achinam ekon ni nyina eka ho ma wanum no edimu na Kojak ehun se ye wo binim wo ho a ade a ye nwu ade a ye hye ye ni di ayomden obi wo ha oya wo se ahyemese say ye nyu say ye hye o wo sa hye mese ana say ne se efemfem no enti Kojak hu say saa de we no e de pa na de betimi asi ano kwan ese se nipa bia bibi touchma e wo nipa dua mu a ana say bibi touchma o ba bia ese se ye hwe ade de betimi de asi ano kwan enti Kojak hu say omo se femfem wo mo no ana say omo sensitive teeth no ese se ye nya bibi de besi ano kwan e na wa ye Kojak P paste e na ne mouthwash na ne tie ne say wo a wo se femfem no na de di kan no wo be hye ase use paste no P no Kojak P no na wo de abrush wo de twitwi wo sene fine na da bia ka say Kojak ye president ana say ye paste ahoro e de ababonten no ye mawa na ya mawo brush aka ho wunya na wunya brush aka ho free enti wunya paste no na wunya brush ne ka ho a wo brush wo teeth ni wi a pu ahoro ni gu na ma de aka ne enye wanum be 2 to 15 minutes aye Kojak P no na fe wo de ne mouthwash no a wo gina wanum fa gina wanum be say 2 minutes after 2 minutes no wa pu agu memfa nsu ohuru wanum janesa ebebo wo sene ho ban faces femfem no ho obi a ne de ne femfem na ma echire kura na se echi nam no kwa timi fi moja ena mesra wo se wo use Kojak P na wo use no just 4 weeks pa no wa jai to na ya fa ba akwa efe Kojak F eno se e pace ni bisa wo de no de wo betutimi e de twetwe wo se anytime bia ema wo mo a omo wa se femfem we sa pace ahoro mienu ene ne mafo shi ejina ho ma wo ma wo se femfem ana se omo se eta ye omo ya pa eno achi no ye fi ho a ye nim Kojak se Kojak Procode a dro ba ko a Kojak fo ye hwehwemu e de Kojak Procode na babonten hu se obi a wo kata se ne ye kan no ana se wuti pai wo awode wo hu se waposo ho na munya ye wo ya
na nsensu se dia weda na ye no
enche bia na se ho na me o kata na obode ni na o ye adwuma kakra bia na wabre aha enunti Kojak hu ne se painkillers ahoro a ewo dwaso no FDA fo nhwemu kire se wo ye painkiller bia no a esese wo no madu na 15 minutes e kono ese hya se ye adwuma enti Kojak asan aye biem aye ne hwehwemu na hu se 15 minutes in ewa obi a ne hwenu mati nsuo obi a ne hwenu asisie obre onum wi aduro na just otwen 15 minutes ansana ahyase se ye ne ho adwuma enti Kojak e de aduro sonko wanwani bia wura eye saa ni painkiller na fe ni Kojak Procode ni mu a eno onom ya pe 3 minutes na ahyase se ye wo ho adwuma na wo ho ahyase se wo ho to na eboa wo abo apom
me ntwa no eno ye fa ne sen
eno ye fa ofa baako
obefa baako eni nsu ana
eduane eno de nsu
me peduane
ope drink ne de
me dro na am de shebe nku fifi alafu fo fifi
ene wo pedro no mkra ubetime de ayene sa anom ye hia ne se ebe ko but sometimes ya na ye hwe se ne betimi absorb ebetimi ahono ntem aha ehunu ana hya se ye adwuma
nsuo ne so ye nsuo nyu ana nsuo hye
labi se enye eni kwa se ye se ne obi kan so mepedi a chile no labi se ye normal ensu a utimi edidware utimi de hohoro ho aha normal ensu ya eno na ya na eboa
etu be fa ba ko pe the whole day
ana labi anopa eni anwumre anopa na anwumre ebe boa wa ma ho obenya hoden wo se ho no se de awode wo no bi okra no ho ahyase se eti fifi bo se wo se wo ho san ba wo ni padua mu hoden ne san ba bi mu aha enti Kojak Procode ne wo ho de bia ye ka se ukọ pharmacy shop anase chemical shop wa wo so pe Kojak Procode Kojak for Procode bi na wo pe ye ma bi fufuro bi a ma nyintu obi be ka se o ye oba ko bi wo ha no de F eno so de wonum a ubetimi benum be miensa kra anan kwa toatoa so but ye hwe de be ma wa hoden na ma wa pomudi na timi agina yi Kojak Procode na eboa wo ama wonum ya 3 minutes pe na hya se ye ho adwuma ma wo ho atimi ato na se adwuma ye se koye no wonya kwan akoye ya dwen asa adwen abusua no hu se enkwala nso wo ho enti Kojak Procode suspension e wo ho e man kwala woto akoma kwala na ebeboa no na se le ye man panifo no saa so na ye man kwala no a eboa 3 minutes pe na hya se ya obofra ne ho adwuma ya na ye ka se okwa e ma ye mfa so kwan na ne wa chenchina enka se ye waduro fufuru bi wo ha no beboa eno bo no wo fom ji Kojak Procode emo abofra na wo pani so ji Kojak Procode tablet no na no ma wa pomudi entimi nyina yi maame ye hwemu a ye saya besi achi e wo ye num ahomidi ne ho ye kan anum ahomidi a ora ke no amanfo amfa ye ni entimi emma ho no ye wo Kojak regular fluoride paste eno no e wo ho se abribia obia betimi ayusu eno no anopa ne anwumra betimi brush teeth no da bia de e kan say Kojak a product na e dia babonten say wo brush teeth ni hwe a pu ahuro ni gu memfa nsuo huhuru wanum esa say paste no esa ye duru a eye wo sen wanum ne ho adwuma eno nti say wo paste hwe a pu ahuro ni gu ena yenso ye paste na Kojak regular fluoride paste no wo tikitu bi de to brush ne so a epu ahuro eno nti etimi brush wo sen yie pa eyi nneema bi akohye wo sen ase ne wo techemase nyina ena yenso sane ya ye research in first nanka brush na de atwitwi yese no ebi ho ano odin pa obi okoto a wo se me amede ano odin na ebetimi ayi menum nneema no nyina Kojak aye nhwemu ahu se saa de ne kura etimi boa hadwen ema yesi achi nam no etimi ema ne bildi bo se efi moja ebi ho na esan wai when na no sen no de bo ho ban no na wai no enti Kojak nhwemu a ye no sesi a kire se brush no esese ye mre fine na da bia no wo brush wi a na wo horo no fine ye ka say 3 months bia bo modern so besesa wo brush no
every 3 months
3 months bo so me miensa bia
na some dem brush no put mo paste na any brush
na any brush na nam na ye paste ye brush no kwan so emu odin eno so entutu na entai na enso so ye tufu say sana ya na bacteria wo ye num a yetimi yifiri ho no dodo no ase ema wo brush cha 3 months na bacteria no bi na kwahye brush ni mu enu se be ya betimi ma wonum adim atimi adimu na aduru atimi abo wonum ho ban yi no bosome miensa bi asesa brush no ene wo bi dia tai ayese woma emu ya won sesa no obi die no was twini sena se bi antutu ankra no mu a won sesa no wonam onkayo ada obe brush ne se obe tutu ne se pe no akai se esen ka metop
brush
enu nti na Kojak se o paste ni sa ukoto paste fufura ni ama brush no akai hu se ese se was sound brush no na brush no se yesa obi wa bonten a obi a betimi atobi enti Kojak regular fluoride paste no wo ho sa anopa ene anwumra o de be brush teeth na bon o se ne ho ban ayi enum kankan ene service proye atimi afi ho ma eno achi no Kojak de enkwala so de aba Kojak kiss paste eno ba beboa ama nkwala no enum atimi ada ho enkwala ne se atimi aye fe ena esa bon nkwala ne se ho ban afri bia ne se no bia ne ekeka obi won sa na ne se ne efi moja Kojak kiss paste no ya ye fluoride na de ya ye ene flavor na ye de aye no dent nkwala ne pe enye so obedi die
na so set ice cream
wa won chance wo kwa na wo bra wo twitwi uba ne se a but sentence smell good utimi say yes a drop penny ena ya to ebo asa ye hwemu ansa na ye de ba bonten eno ti ya ye ne yie pa ebo wakwala ne se ho ban se nkwala pe sweet pa sweet ne so attractive bacteria se na de bia hwemu ame hu no eno nti eya na fa Kojak kiss paste no ema wabofra no wo to ane ya ma brush free na utimi eje twitwi uba ne se brush esha ho free ena ye ka say akwala no enka ebi aye pace ahuru e wa bonten 2 to 6 years ena yo 6 to 12 years Kojak de eye 1+1 to baako a utimi de kutwitwi ko pem se obi a wadi 12 years enti wo ma ba miensa baako wo 10 baako wo 9 na baako wo 2 a utimi yusu e ma ne yeyi wo to baako a eno ano na abebo abusuamu no nyina ena Kojak charcoal toothpaste eno de meteso anu asore esa say deep stains and niema bi akeka wo sene so ache udodom ho obi o ha wo we nam bi akohye oni yi kura ye ne den ade be kye na akeka ne sinimu mesrewo adro ba ko ebetimi aboa wo ena sanmanum esanum wanum da ho ma wanum te
oni obi kasa kra on fere
mu say obi o ha wo ne kasa na so sisi ntra sa wo ne nsa kata na no obi kura be gina ka mu so wo kasa age so wo ne nsa kata na no sei ni nyina no Kojak charcoal toothpaste no ebe yi sa sabe enum kankan ene support na nyina fi ho mam ene niema akeka wo se so wo ma enom cigarette obi o ha wo we bese pa yenkurasi wo papa bi wo na bi we bese opepa mesaw ema ne nya awe eno na de a wo pe na emom to Kojak charcoal toothpaste ne bi ma no na owiwi a wo de twitwi ne si a ebe yi eniema bia obi wo kra eya na ne sisi twitwi ne kra ayeden oni adaje obi o anopa wo so le into one time twitwi mesaw wo se bia ne sene ntantem ne sene achi ne sene ase wo nyina bia ye green ade Kojak charcoal toothpaste no ebe boa wo eyi saa enema a ye basabasa ne nyina fi wo seso afi wonum ama ho atimi ato obi wo ha me no ka sei onom caffeine colors foods odipa eya na eda ye techema so da ye seso ade ba ko a paste betimi ayi afi ho ama wo eye Kojak charcoal toothpaste and a bit me use animal in your floor. I'm a woman daho. I'm our sense so when we say was sent up higher if it are. Mamma for number no and tuja. Okay. Ubi was in Bisabi. Ubi Yamaka saying Nano, Ubi how person be question. Exactly. Number no a 02 more Babel to our tongue crown soup. O pedo to an inano, a bemobi. Number near 0244 55 95 97 0244 55 95 97 and Accra Hano ye Barbara and number na medema we and we 053 122 0985 053 122 0985 and offer Madam Barbara Obejo so Accra Hano your kanshi draglin e ho na be hu Kojak e pharmacy kese ne wo e na wo Kumasi so a Kumasi ke yete dwa kese ne man kasa ho so be hu Kojak wo wo a wo pe bi atu wo a wo pe baako wo pe baako a wo mpotem ho wo bo wura supermarket ana say provision store na wo betimi anya Kojak product ne nyina bi wo ho e na eno achi no da bi e bon kai say adwuma se ho ayeden de ne nso so enei wo kita kakra bi a bra Kojak ahweye beji pace na hodo ni bi traffic na achi no wo gina ho a ubetimi aton bi obi wa on kaise ne pace asa obi de no wapai mu e no de brush no no de awurawura mu ofi abonte a obinya bedu fia no pa no be principal no aka no man to pace wo enti wo gina traffic ma e kai no e mo no so timi tobi wo so adwuma e na ba bia lorry station ho no eni market ho no price no so wo form wa kitu kakra na obenya wo so bo say ade be sana sabe wanya wanu aduane kakra wo so betimi e de ahwe obusua enti ba bia nipa fa pa na wo so betimi asi table kitu bi wo ho na wo de pace na hodo ni nyina do na guso na ya mawo enema be boa wo ama wo so watimi aton na wo so watimi anya kakra e de ahwe good business idea ye bo ye say obia Kojak yaba ama busua Kojak yaba ama Ghana yaba ama bibia enti product na ye de aba bontini nyina no ya yenhwehwemu mapa ansa na ye de aba bontini me ba cho bo number ni biom number no bojo table na e no o kan wa ma aye me de pa eboa pa so we need traffic mu kwa na wo fie enim kwa na nipa fa ho o se ba bi ho a kwan kakra da ho nipa fa ho pa lorry station ho nipa fa ho bi a wo fie enim na nipa ta fa nyina no wo de bisi wa betimi abo number no 053 122 0985 and your sister Barbara number no 053 122 0985 and I say Mr. Edward Wokumasi on number no 0244 55 95 and 97 0244 55 95 and 97 Kojak and a dinner ya pomuden ye num apomuden komo no ebesi ya da sepa we de me professor no kra ma odeda because Professor Frank Osahene or your PRO and they was such marketing skills be and I think it's a very loud about of a Kojak farmer and a buyer on any bon komo afa Kojak no that mouth bath no and na me pese wo che anything and no Owusu Kojak P no a ne ma for so ka ho wo de paste no e brush wi a no apu ahuru nego wa twen be 2 to 15 minutes now the mouthwash no ejina wanum just 2 minutes ejina wanum 2 minutes a wi a no apu agu samom eno am na me say so mpese obetwitwi wo sia na Owusu mouthwash no e wo hosa ate yanum ate yanum ka ho de but eno support e boa ma wo ma mo sefemfem wo mo no e na Kojak e for no so ye sefemfem saa ba eno so ne mouthwash ka ho eno so brush wi a na wo de ejina wanum 2 minutes na wapu agu Professor PRO papa Franco say ni PRO for Kojak farmer yedase enewia we nyame shop na ejuma pa moye marketing ideas ni de me champion ma because say na obia nkofo bebre esu ejuma enu da me sure say ubeji one pack now the good table so now the traffic ma Ansah na de besa no ebesa ebesampa nti edase enewia back to studio B makajo say ne nyama good table no so do so na ye de aseda ma special ice mineral water mo so ase na edjumede ebremo sanso na me de aseda pa White Stones Dental Clinic and a White Stones Eye Clinic omoto so yase and edjumede ebremo HF Grills so in the 5th anniversary omo celebrate anniversary nti eni omo na start eni omo na HF Grills
omo enye nam no omo anso ena toto nam no enam a yedi eyi wild spice meat pa well grilled the real wild to say yes we are Ghana nam Ghana spices na dia hye no me pa cho omo akoko omo turkey omo quail omo san rabbit and omo san catfish I HF girls for enono obetumi from 0277 604858 0277 604858 HF girls me pa cho from na your order ewia we ya na wa testing am no na ma me feedback ai omo boy na di jumede ebrem mo hwe on Facebook nyans ye da mo nyina ase mehu Osman ewo ho sanso na Victoria Owusu ewo otu ahene Charles nso sanso na Helen Asantu anso tie yen Abdulrazak Aziz medase wo Dr. Jesus the Humble King medase Edmond Ej Bright Yeboa Suleiman Isa Frank Chipsom Steven Zaka Munina Moshe ni ama is watching sanso na ofusu abenison so hwe ni ayi Leslie medamunina se Kufo Jonathan medamase Abu Alasan Abudu Ahmad Ahmuda medase Techi Samuel medamunina se D Abu Samuel Bao Dokas Daku Malik Berry Mami Francis Emma Alex oh modos medamunyina se kuku medase efia medamunyina se Owusu Mark medamunyina se me ba cho mo hwe na mo share page na amaye mo hwe na mo share page no eno na efe no onuado na mo nti ase eno no medamase. Back to the studio with Dr. Owusu Ansah, or a medical practitioner or science CEO for Healthy Soul Medical Center. And that year bonkomo afa neurosyphilis. Muka as an out tribi or betray muno wahano ye kasasa na neurosyphilis ebemu. And I share bosse ye bebo hunkomo ai wasamba inti ye babebo neurosyphilis e hunkomo. Menim syphilis menim se ye impemu agrodie na neuro ni ya adwen na impemu agrodie ni eyi u brain ni de doctor na betimi a kire mu yi amanzi dog ye ma akwaba bibia bokọ de
oba de adaroma
ye danyamia se we Healthy Soul for ho to sing we client yes say enka patients biom yes so clients na ho to sing
omunyina ho ye
obia ho ye
ni gisem kese
ye danyamia se
sabi on say we ye adwuma e fan say clinic we ye clinical meeting maybe I feel munyina na say en fan say 2024 yi ya chemu mienu now we o mortality meeting now hwe na say obi anwu e wo clinic I won't say achievement
omo mortality na say na say obi anwu ye dia and say a doctor for mo hwe sa nyama nyina
ye hwe ni nyina
sa
second nipa na baaye no say bia munya nkofo be 1000 a o say mo hwe mo check obi a say bia obi ewu na so obi afimu
wow
so say na na ma wo de ereti say the oye no ma results and na say also change or style practice
and the doctor stress idea no wow I never knew
oh hospitals like I said every week but private clinics in the be 3 months
no ma hwe say nko fine na aba mo ho na mo buy no so obi a ho ye ana obi efimu na wo dia access won so wewu ana hu niamba either say one fan draw ye bibi mistake ana okay
so be on one fault and say a fault
clinical
we practice na that is a change in your man
no okay
so be an win so that near improve
science is always moving they say it doesn't stop
we need the man we feel very fulfilled this year
yes so far nyamia dom ye danyamia se so mo a wo show mu nyina obi ati apom obi aho ye hwenka nipa ne ye
sometimes the condition is very critical yenya cases CKD yenya EGFR like 2 yenya 3
wow
yenya 7 and
they are all kidney
yes the kidney I say na ni EGFR so
filtration rates no
exactly
above from cry
within 1 minute filtration rate I was saying onya
90 and above.
Yes, 90 mils and above. Obi one dey that 6. Obi one dey that 3. But all those people no still omo nyina da so test.
Omo da so test. Training omo ye. They are managing their life.
So cost. You how by na 3. Obesan buy 1 month and
na cost 5
cost 7. Yes.
Nyame hwam na ejuma pa amoye. Da nyame ase. Nyame na eda na ase. We enya wa ho odin o. Enya wa ho odin nyame na ye.
Me ya na me crampo me ntse me ho ase because any man bi o ho a on say who patient na okọ no ho a o lose hope. But obe fair do no be call be ba no you can't even recognize the patient. Abi dey all kind of 100% say enye ma ho odin. And I mean tna be bia enhwahwa me ho say me na me David enye ma ho odin eni me nyansa.
Okay. Yeah, then I'm asking. Now, dog, you quit him, and I did. We see a baby bonk come off on neurosyphilis. Yeah, dear. Ye more. It's just a wild church.
Right. So we'll start your intro. No, now we'll try to obey breaking. We'll try to obey breaking. Two
words.
Yeah, obey breaking into two. Now can wait me on my eti for what So syphilis. Oh yeah, right. Syphilis no. Yarea. Yenya ewo endemu.
Okay.
Yes, nti obi ewo you can say one of the commonest STI. Na say obi na oni share endemu na one bo ho ban a na wo so benya. Na emowa no ewo ye ho nsuo mu. Say wo ye bema sabi o cement and as of sperms no. Na emowa no na wo ye oba nso a nsuo na efi ho eba no so no. And so emowa no ebi wo mu.
Nsuo na eba no. White creamy discharge. No na
emowa no ewo. Yes,
and I we bema nso dey fi bema ne ho ba no. And no na syphilis emowa no ewo mu.
Yes, that's the one I friend ejaculating.
Okay.
And no na ewo. However, oba nso nyinsen a eye placental blood no. And also emowa no timi kom. Nti otimi de ma unborn baby. Nti ne ho asema.
But so at the end of the day, mpemu agrodie na deba.
That's it. So that's the syphilis. Na emowa no so intelligent to the extent that it may penetrate certain areas to say genitals. Nyankopon ebo nipadua no wahyehyɛ no in such a way say or the enuma bi protect ye. Don't say ura studio has ya. On say the decorative has say na. On say o don sa kan wall na. On can wall straight.
Yes.
So there are some foams.
Yeah.
Before foam the crown some the other will be line be so nipadua no so no sa na nyame ahyehyɛ no. Wahyehyɛ no in such a way say say bi abo bi ura nipadua mu a on call moja mu straight. Obedi kan afa enuma bi mu ansa na akomoja nim. So your favorite be mucous membranes. Na sa surface mo awe no omo etimi wura mucous membranes a ewo yenum. Nti on say we de ade to wonum a sometimes ehye but on ten papa ba edu minimu a wote pa say ehye. Yes, need this one we a minimum mucous membrane enye so powerful and as enye so strong. Yenum mu de no but ye minimum de no powerful a say edu ho a obetimi ade a containing enti esa mo awe no omutimi penetrate sa mucous membranes no afi yen skin a ye frɛ no epidermis yen skin we no estrodia no mo wa netimi breaki no ma afomu akɔ moja mu
omufri hin na be breaki
go enti yen fa no sɛ woni obi ahia ni semen no mo wa ne bi wo semen ne bi obi house na menye coitus interruptus. Let's just say ono no ebia ne ho ba ana sebi ne ho sane na on fangum ebia obe puli nti opuli a
eno na efe ne sen
coitus interruptus.
Is it different? Is it coitus interruptus?
Yes.
Ana
interruptus.
Tocus.
Yes.
And actually interruptus. Okay.
So coitus interruptus.
Interruptus.
Yes. Nti no not just person obey ejaculate into the vulva and as a vagina until obey puli into puli na nsuo ni bi kra gu osre ho and I say labius So, one bit.
Wow.
One bit me penetrating. So, most of the early signs of syphilis, yeah, na etukro. Ewo bia baby aboa no ebewura.
Dog train. Na che say, obeka so enye me na me enye like obefeel say o enye me because me no die no sebio me tufiri mu.
Exactly.
Na nso wonim se o tufiri mu no nsuo no baby nsuo no gu ye betimi abotokro akọ inside saboa no wo mu dia.
Yes. And most of the time, when they do that action now, obi on yi film gubia tissue me but o de gubia ne body anti bones hono bacteria no betimi everywhere mu.
Wow.
So now
almost fast though.
Very strong.
Wow.
Very strong. And it's in a from almost scientific name. Treponema pallidum.
Membo.
Oh, but you'll try.
Because
you just
palladium munde makai.
You will love the history behind. Also, the because medicine, Latin and Greek.
Yeah.
So if you know your language, your etymology, it becomes very easy for you to understand. And trip.
Okay, trip.
Yes. So trip, TREP.
Okay.
A Greek word. It means rotate.
That's like the normal tripping. Yeah. Okay.
You understand?
Yeah.
Yes. So it means rotate. And so triponema. And amuano on say rotate. So 10. So another word for rotate means 10.
10.
So that's the trip. So Nima means tread.
Okay.
Nima means tread. So ahoma or 10.
Or 10 and
Into the typical example, I would be who said the abuanity. It is a wine opener. Also, wine now, that's a omudi DB ashemuno. This is all the screw, no?
I'll call around.
Now, watching
turn around.
Now, you say, never, you know. So, who saw at the pin, no, said it here.
Yeah.
Sana abuanity. So, Treponema pallidum. Pallidum, no? And so
Treponema.
Yes.
Palladium.
That's it. And treponema na ye tremono. I know you're Greek and Latin word. And that's a Greek word.
Yeah.
It means rotate or turn. Nima means tread. So that's why I'm very powerful. Because or tall skin one obet me at 10 and a host not the money to grow. They say almost examples in almost shape to say, sir, I didn't be wine. On say wine, you'll be her. Yeah, what will be assume if you be shame not just a day. At the end of woman, what chimneys are not would be. So we call them sparrowtites. So another name for the treponema means sparrowtite. Now, palladium or pallidum means pale yellow green. So so abuano we need to or to say pale yellow green. Now the student the bind to say corkscrew. So that's why we call them treponema palladium. So that's a syphilis species as another abuana or also syphilis. Now, who say syphilis mwawa omo yenya omo free endemu obi no obi da obetimi enya bi nipa no obi a obenya afi who say so painful enso enyemo a na the placenta blood because say ofidi abofra na with blood in it ono so ebetimi enya so yehu eno. Now let's go to the neuro. Good. So the neuro means nerves. I just like your interviews because you always send a person back. Good. You. Okay. Good. So
a be show mu skins.
Good.
I say syphilis no when you be na ube
Yes.
dey hu say menya because their okay is quite us interrupt to see in go for ye bi and no bi no anya this vagi it's STIs ni bi omonti omo ho ase and see say one aka chen say syphilis to me like wherever your friends say liquid in the begu no to me rotate rure mu ebotokro e hye na when you be obey dem who say symptoms ade ye gu me hu syphilis and na syphilis pa choche no and so na yakọ neuro no.
I just like your interview. You always send a person back. Obe deliver. Oni me be obekọ ko hwe kra ba ko hwe.
Oh dog am afere.
Oh yeah, I just love your programs. Inti the ten say obi o ha obenya syphilis no. All right. Baby aboa no ewura ye no. Obenya kro e wo ho.
E wo baby ade.
Yes. Inti say onya no ora. Medical ka say ye wo nioma ye wo places ahodo and 9 emoa no e betimi ewura. Eye the aura.
Wenum.
That's yes.
Okay.
I feel your epidermis.
O skin. Just wenum no wo takra wa no ni nyina ye wenum.
That's it.
Okay.
The genital.
Was say ho no mo.
Yes. And then the intestines. Now a hot na me interest in the wo.
Inside the winter.
Yes.
Whoa.
Your intestines. Because sometimes obey diagnosis. Na nipa no wo syphilis. But when you say when ya any lesions biya e wo the genitals. And you know it is harder for them to believe say or syphilis and I say when you syphilis. You be do when you do baby you be kan neuros no ho a e ho na you be do more pa. And to say aboa no e fa wo genital baby of fire no be hu say we ye be ma eye pineal gland no ube hu kro kakra e wo ho na se de ekronity e kro no enya ya baby eye painless ena ekro no so the side and side no e ho no eye
raising
I say a bit I raise it to say the yabo kofi no ne kro no e wo so kakra bi on say o kro bi wo ha I say ade atwi ho
say no flat
but syphilis kro no a bit raised
asa abo pomponya kakra
there be your pomponya
okay
pomponya na your blisters
okay
but when you kro no e kro na be too all right but
e kro ba e raising
na raising kakra side and side na raising kakra na say moon baby kro no na boto kro kakra bi enya wo ya
wo ho na epie
yes na o twi mienu na kro na nka say wo ye treatment wo anya treatment o be wu
the chronic bar.
That is the primary infection. That is the primary infection of syphilis. The chronic
now, doc, sir, chronic so here, magnify glass now. They are sure now do any
they see it.
Okay.
Do any but sometimes I can say very because the baby are born be fair and all yes. And see, or quite Roman was silly going back.
Is that to corner bone fin Fiona a baby
right?
Hey!
No, silly.
We're silly that she.
And see, and ya. And see, once and pebble no so, in your crubby, but a no alcohol. Pebble
also, so immune system are fighting about.
Yet it plays a role. It's part of it. Your immune system plays a role. In your first exposure, no, the immune system will play a role. That's why a chronic me a
weird.
Yes. Now, with a secondary infection, a core or system anymore 30 days to 90 days. Now, Ansah resurface with rashes. Now, on the rashes, no, and also a raise and keka. But disgusting. Do wrong one. Or partner be who say
Bibia
rashes won't say offery. So and see now both any part and none knife or share solution because overall when they be infection I be good so like and I rashes no abegu koko so bebre titru nipa kokko for no won say rashes na abegu ne koko so bebre ana na chi bebre and also ba on the most of the time they seek medical help because ya na
gu echi bebre
na koko so good nti no otimi ahwehwe say obi okra etimi ba na han mu ene sabi ne scrotum and then the genitals no ho.
And the dog, how long does it take to have all these symptoms?
Good. So with the incubation period, a rare skin acquire between 90 days and 30 days to 90 days. A besan about with these rashes. That's why we are February. I drink a fish because now drink a fish say when you will be cried that be a sebi who say crew. 90 days, then it comes back with this. Now after a year. Then
it show almost a year.
Sure. It show 50 years in
syphilis?
Yes. Syphilis could live with you for 50 years.
Whoa.
And we will discuss all of them today.
Okay.
And see, 1 year time, that is where it tends to tertiary syphilis. And no, both the dependent some say. Think I'm someone I the whole plane say. If we won't say a human see black.
Yes, some black.
And I say me nine mu. Dependent nine mu. So washa. Obi o has said obi fi mu no. Bunum say syphilis can become a life threatening, fatal. Yes. Syphilis a bit me am away fi mu. It was a dependent fi mu no. What shall the name say no? Since black debris or nine and I said that's the tertiary syphilis.
Yes, I do advanced stage.
Yes, I do advanced stage. Now sometimes I host some kaka or syphilis any just some when say early stage is so easy to cure. Yes. But say every year tertiary. From secondary to tertiary, untimi cure. And see, so these are the few clinical symptoms and as a signs. So even symptoms in podie, na nkofo omunte hu, but a back with the rashes na, na ema wenya fever kakra. Nipa no ho be yeshi. Now we feel some your baby prodromal syndrome. Let's say or no or nyare so on tiapo. Those are the symptoms. Kakra. Bon say free be a nap nimpomu ne ya kakra. But the signs no yen ye be hu yen doctor for ye be hu no any sa rashes no any sa patches na obi hu won nsem ne name no. So these are the clinical signs. With the clinical symptoms, a bit feverish with the prodromal syndrome and sometimes general body pains. But all these things will go away. So within 1 year, two years, the person has dealt with it.
But it's still there.
It's still there.
Now, I walk on spread.
A honey common.
Hey.
So all these one, the person is a carrier, and say, oh yes, sex no, I'm here protective sex, and a barrier contraceptive, not all spread it or they check, and I say also OJ.
On I'm not check.
And see, Sanema when you know now with the neuro. So the nerves, and I say, ye nipeduano, when you're ball. Intini and this be William said there's difference between intini and a droben.
Yes.
I know so the winning. But sometimes we can't present a viewer or name the difference in po. Intini no emoji film. Droben and emoji film. Intini emunsi. Name ewu. Droben and emusi. Na and no your friend and nerves. Intini no your friend and nerves. Now nerves no you group into two. Your CNS, that's the central nervous system. then you have the peripheral nervous system. Nti sa emwawe ono no pe central nervous system no.
Ehon na no beton.
So nti so ra o fa wo minimu na koto wo intestines mu a obetimi penetrate wo intestinal mucous membrane na wa famu akọ wo mogya mu na wo wura wachi kase ni mu wachi kase no that is where a kwan eda before a obia betimi bibia betimi akọ wadwen mu no efa wachi kase na ansa anasa aboa bia betimi akọ wadwen mu efa wachi kase na ansa na akopie ewo wadwen mu nti emoa no ewura onsono no mu na wapie afamu because ensono no so moja edi mo afisane kọ ede ne nam kidneys ni mu ne ade nyina na afamu na wafa wachi bremu no mu and onya du wachi bremu ne pa ensuo bi wo ha ono da bia wo hohoro ya adwen ho eya ye frɛ no cerebrospinal fluid.
Okay.
So the cerebrospinal fluid no ono okosro na wabafom oko. Okay.
Home so na men kan share for so that's why share mo here show live on okay 101.7 FM. Pacho obian fa ne pen ne paper because the doctor akasa nyina me church me de me gidi se wo so church de wo question bi nso a church ho emre ne du a be activate phone lines no ana be mama WhatsApp number no wo person your voice note nso ye to ho ye announce number na why your voice note na to na Dr. Ansah amao ye ne Dr. Owusu Ansah na e bon komo or your medical practitioner science CEO for Healthy Soul Medical Center and na ye kasafa neurosyphilis me my boss shock ne ma doctor wo bo no ma boss shock rough mo amufu say amu dodge me nya ohye wonyam na makoy coitus interruptus akoy to free bu ya doctor so boa ade na ohwegu to ho na osra ho no botokro syphilis ni bi wo mu ha botokura rem entin pamocho obia nyen na so munye maso pa because doctor ebie keys na nya betimi di abo ye ho ban. Back to the studio with Dr. Owusu Ansah, a medical practitioner, CEO, Healthy Soul Medical Center. Doc, now we do ye chi bonus.
So with the CSF, which is the cerebrospinal fluid.
Okay.
No need ya and say ma brain no buoyancy. And I say all cleaning adrena hono. Aboa no be fa wachi bremuni musa na wakwako pie eye sa adwene mu na adwene so nyankopon so ahye ni such a way say ono so ewo ne asojafo a omo protect adwene.
Yeah.
You from the meninges. So there are three major meninges omo protect adwene no. So be kai o biology kakra you free ba ko pair meter. Okay. Pair meter. Yes, PIA.
Okay. Makano.
Pair meter. No. Na odikan ewo adwene ho.
Okay.
So I say. Nti no ewo adwene ho se na ebe ya obe prevent aboa bi a oba.
Yeah.
Na se unya sa neurosyphilis ya unya ko adwene ho a sa meninges we na omo target emo one target. So the first one is the payer meter. The second one is arachnoid. You can say arachnoid. American can say medicine is language, it's Latin and English. And arachnoid means spider web. Don't say the spider web with you. And that's tin. Nti sana etie ena yakase dura means the mother. So these are the three meninges, major meninges are almost protect yen adwin and also protect yen brains. So we have the payer meter, we have the arachnoid, and then the dura meter. Now say emwa wanu do sa biawo ya kakra. Until now the neurosyphilis no and so cry your sounds will move two types.
Yes, you better to chemu crap.
The early neurosyphilis and then the latent neurosyphilis. With the early neurosyphilis, no, in Pepe, this be our busa nanka abrante ne ho sisi ne ho so. Sabi nanka kasa obi nya stroke nke bi anka aged. Because we are demographic of people who normally and as a prevalence of stroke and old age maybe 60 years but we almost our brand here 35 25 maybe when you stroke we don't say if you muamaya atiasie I'm not dead pefe say ona omunya syphilis and ona enya stroke one early ages no more it's caused by neurosyphilis. Yeah, mommy. Yes. And see, research. Am I adjatum? And if you move adjatum pefe, say, age brackets between 25 and 40 years. Nipa no share ni bobre in a year, and yet there are no any underlying medical condition like hypertension or diabetes. No, syphilis. Yes, and anybody listening, I know say programming for I don't like the Google one, but the people who have done the research, bones and year research, syphilis or stroke related, and neurosyphilis occurrence in stroke patients. On bit me a year, I try home, I home research, and Cassania said they'll be there to Google. We a research, we're using methodologies at the year. So, because there are 5 types of the neurosyphilis. We have the meningia. The meningeal neurosyphilis. And no America say the meninges infections no start to say the meninges. Until on the signs and symptoms. A headache, severe headache. I feel ni panobon say on timi trying to come. The tini yana yasa into bones said they be on the conditions to be on the chin of friend. This was anybody meaning. No, they are shiny pan. Yes. I feel ni pan on timi share a ria. Obey photophobia. Yes. Say with TDA.
I affecting the panini.
Uti anyway ni na bibi wa uti mo a affected when ni nti mpo sen kofo bebre the tip pie na boss na ni efinsu so washa so that is a meningeal neurosyphilis. So the meninges becomes inflamed and then the person has severe obenya ni tip pie pa nkofo friend no asorobren a twifo no I say asorobren on so and I say migraine on so your migraine anka sanso ho but your tiarea obekono na syphilis na edeba. Now the second one is meningovascular. So there are 2. So the meninges associated with the blood vessels.
Meninges no ho.
And blood vessels so and no and LED to the stroke. So anything that's got to do with the vessels be one it could lead to cardiovascular and cerebrovascular diseases. Now a very dangerous, life-threatening, very fatal, potential life-threatening and fatal with the meningovascular. Now your general paresis. The general paresis is the people that comes with a mood swing. Today, or you're fine. Ochina, on Phyllis or no, we have a bon como.
syphilis, yeah,
Yes.
so yes, I did also.
Yes, sir. So we call it neuropsychotic disorder. So this mental before
And then mean that terminologist pa neuropsychotic disorder. Okay.
Yes. And to bon say na adwene mu ena ede sabi abodam sem no eba. Nti onne de no enye se oye kakra enye se sabi ofa efoma de edi. Na mom onne nipa nkita hodie no a bit problematic. Into omo be paranoid. Into say o can be kura na nyesre and as o can be na esre na wo sre louder. Obeka say o sre no udi ne ho fe. So what I say o kan asem bi na ono ni mu no o fili say asem nka o say wo sre ba wan sre obeka say ono ne wasem. So yes. So the neuropsychotic, so all the time they have issues with people. Or adwuma mu a bo se de bia no one ne colleagues ewo problems. O fi se oni ho a mo kan na chi asem. O pie na oba na obehu nipa mienu se mo te ho di nkomo a.
Na o se mo kan asem.
So that's the general paralysis. That is how it presents in individuals. Now the last but not the least, I don't know who you tap dorsalis. You know you have a dorsal portion of the human being. You say. Now you no so no. So ye chi bremona spinal in bone. There's a cord. No oba ebe ende. Obe ende Ansah wa branch. It's the anatomy of the spinal cord now. Eba besi the lumbar Ansah a branch. Nti baby ebesi no ho emowa ni timi essay sa nerves no na o ma cause paralysis. Nti bon so bi o ha ne form say on ajojo. But for you very active on top. I have seen a lot of young men Owusu wheelchairs strong and sunny bibia or na dey nyina kama
bane form nyina
they've linked such cases to juju and other things.
Bane nyina ye mpama godie akofa syphilis yi.
Yes. So until say you bet happy say more no na edisa or how na ban, they will always associate such medical conditions to other things, forgetting that syphilis could cause permanent disability in your life.
Ebusia I didn't cry Thomas. Hey, internet says impemu agrodie na ekofa impemu agro yare ba no. Eni say e fa na agro. Eni say e fa na agro e wa agro ni so.
Say HIV fever. These are some of the infections leading people into astray. Like ebema wa brabo ayobasa. So say HIV dey ya happy na anti no obvious HIV, but syphilis one of the thing any yet umpo ene wote na mawo yare a umfa wadwen enkos now we treat different things. I mean, I had a condition one gentleman 48 years na obae baby ofi bae no me yes survey no there's an endemic infection of this we ya kan ho asem because galamsey community on say galamsey community so manfra people from different places different ethnic groups and Kabo. This guy was driving one of the expensive cars now be o share a dress in na on fe bibia nsusu nsa papa or yare but the nine ba ku say no a crow da ho na crow na da ho no say doctor a crow we nyese bia ade na twa mi o me na me ma crow na ba because me feel say bibi nam me nine ni mu te say sonsono no enti me de boba enti okoyi boba no on the cam enti boba no or the boba or the boba the nine so
adan
so the or say or the boa na ade na adwo so the bia na obo no obo na 19 na na ho na crew e da so but set trousers come on I send the slippers enti enti I mean so we adwuma we cha who say you start thinking outside the box.
Yeah.
Medicine is always at the consulting room. It's not in the classroom. The area of classroom is a book. You read, you take your history, you learn how to take your history, but a German in IFU. And see, we are German child say patient in the cancer now. You start thinking about outside what he's talking about. Into oh yeah, oh kasaya, I'm so okay. Jawunim, because say syphilis test na me hwe also doctor you catch him some syphilis na secondary school
so he's aware
yes but onim say eno na lead to that and he said me because now I always do this me before me client be kwakoye test no ya na me pese me kire omumua the reason why antia
what is going on with him
because and they say before I ever had say no abi unu say me nya CKD case okita na lab from Lancet unu say EGFR near 3
whoa
but the guy tell it
he's okay
I was sharing tears with the guy he's okay was saying the shoe was born a BBR were fine just that why dark and now spots EGFR 3 and see onye diabetic but or see omo detected kidneys ne say no and Mom said the BP no so cost. So the BP is just like 4 months ago. And it wasn't even so high. I think it was 151, 105. See, me cracking, and I'm trying to say no. I want us to do hepatitis B. You know, on say who take history, there's a portion that you take past medical history. And to me do horn. Let me go say you're catching so or you're Arabiana. No, so you're in country that. So there I wrote nil. But then all quiet in the labs no and I made church in the labs and so yen am so if I say any hepatitis because me entia on yet hypertensive on yet diabetic all his life
but
the kidneys but the kidneys they say into me say be say be our liver problem and sana all catch me say you catch so hepatitis B 10 years ago so what I say in terms of liver no and stress and I link it to the kidneys. You see that thing? So that's how it is. So it is always one problem to another. And then it starts by chronic. I always say that most of the things start from chronic to acute. Or either from acute and then it becomes chronic. You know, chronic hepatitis B. And let me probably take this opportunity now. Some of yen health practitioners. Yema yenin ko and you may be home because or see a catcher and they say or hepatitis B, but need inactive. Also your profile now. We have hepatitis B profile now. Your chronic inactive. Your chronic active and those things. Until say on the catcher and say
it's inactive.
Into what 200 10 years ago. On your profile ni bio, on your viral load bio, on your liver enzymes test ni bio, and I be liver function test no enzymes ni na. Ewo so.
Load ni a chum.
So that's how it's always linked. Into guy idea making so also on a catcher and say or syphilis no or SS. No dear we SS no why the girl I'm saying when you ska or warrior wo na the end one so no say na we nso ni bio
ni we nso ni bi da nyame ase
obani na chi fine any hepatitis.
But it can happen like that.
Yes, it happens.
Even though now.
Yes, it happens. The one good thing about the neurosyphilis is that nerves anymore. Sometimes it is not in the reproductive.
Oh, okay. Okay, it's a movie free one.
So, and I make a chance to say, syphilis now when you are say, affect the nerves. And as I say, man, problems. So now I'm saying, I'll test. And way back about 25 years ago, and the catching is or in Yasif by Ochuti, you're born a panier until on the office a cop. No, yeah, test must store reactive. And the test, and the detector says, oh, syphilis, your friend of VDRL, Venereal Disease Reaction. VDRL. That's it. And so be a bit me. Try the at no collab. We dear doctor and Shoka Mawa. Wow, oh, they will cast a require fee VDRL now. So, yes, the first test. This is the test. And we are Lancet Crampa a very detailed. They are able to isolate the number of bacteria and a war near the anti. Yanami percent of
Abusia still live on OK 101.7 FM. Mami activate the phone lines. I mean, some more questions. I'm person will be doctor. And see, Mami activate the phone lines. Na mamo 03022435547 03022435547 and now 03022435529. Alternatively, some patch over to me. I send you voice notes and now WhatsApp message about 059 620 0902 059 620 0902. Alternatively, over to me as I know WhatsApp no akọ no more. Na doctor amay nyina ye mashishi. This when I Uber friend causing panic, fear and panic.
Oh, I don't mean that, please.
Causing fear and panic. I'm going to be a machine. As I know, listeners, no matter cool, this is a matter cool. About the cool, this is me. I said a matter cool, but it's a serious issue. It was young. Debbie, because a show is so no, yes, yeah, dear. So when you get the opportunity to tune in and listen, I'm partial teen ye, not short to her. Who see dear they ball who buy no. Now bow a bussy who buy, now bow community members and so and who buy. Mom will be don't worry. Doctor, I was going to go for some number. The mamma answer number free today. The number never mamma. And the number never say a trouble. Had there be an amount doctor number. Now my friend and see the mamma. Doc, Obinya syphilis, mutumisa.
So, Tianco Ashasi, I say, Union Elina is so easy. And the Ellen, no better science and answer, what treatment. No. And two ones are who bad, yeah, a cry, a better one, song, and now song, and now baby, and now I know who cry within 2 weeks.
2 weeks now, call your work for say, you're okay.
Normal, yes.
So, how would you know?
Yes. So, the honor and prepare, William said, most of the syphilis patients now. Or my back and a catch room, and that's almost 2 and among alcohol hospital in Yano. A bra or more donated blood.
So, what donated blood I check?
Yes,
screen. No.
Nti, one more Ancasa, one more 2 and among back hospital say, me nya, yes, me nya syphilis into no, me baby treating a year. Either Nere call and yes, your matrim moja, near whom yet. Either Ninu be, and I say voluntary. Be a blood donation be na or 2 and among alcohol na or ye na you screen and catch on say for syphilis and pembe no they asymptomatic yes so until say it becomes complicated say the year come once away so the complicated ones that starts from the insomuntiminda over here paranoid panic starting yenya or funny feelings and sana probably will be too and on a drew nerves anymore I started a cause of all these problems.
And the dog you was somebody poor.
But I'm surprised you wouldn't say you be kind of crap who started year health a 10 years long.
Now Omuntio It's here now, funny say. I think say time on beti na just nipa no problem libi.
You will have a problem.
And they will call you. And I know now can say ni sympathic card of many doctor and number. That time we function it.
See, also approach ntisa. Also approach proactive.
Yeah, they prevent before.
Yes, they do. Your favorite be wellness clinic. They do that well done, and also they do that more than here. Here we do curative clinic.
Say we are answering about hospital.
And in fact, me mumudi I mean support it. Say subaino. Kamenya pa miya kasa beyond the medical fraternity for almost 20 years. And you money be high intimate cure. And I building by adwin.
It's true.
Baby.
It's true. It's true. So who buy
but when it is early detected, one day me boy me say my one colleague doctor be minimum, but a client came with EGFR of 63, 63 mils per minute, and the woman came. Only a woman, or a young lady. Oh, buy a any home control, and Doctor B. So, Mama, then Embra me ho, Embra help you so. Then the kid started on the Okitana Labo. If you are an EGFR and 63, I said, wow, if we have such doctors,
proactive,
about 10 or 20 in this country, dialysis is unity I to me. Can you say that a bit problematic? Yeah. 63.
That's why
I had a problem.
It's true. On my chair, it's true. Charlie.
Wouldn't say UK standard no. Say EGFR 82. Wouldn't so I'm target as a first stage of kidney problem. Yes. But I had the system no the yes okay. Yeah the probably a fitted word I think a year back. And see yeah they are back from crab 63. 63 mils per minute until do what and Sunday who say oh problem. Now obi crack na do 63 no yen ka hwe
we okay crack because they are seeing cases of 1 and 2 and 3.
I started having people's labs from UK, Germany, and they some 82, some 79, and they are telling them they have kidney problems. Now when we say neurosyphilis, syphilis, it may say kidneys.
It's me, it's me more. I unya stroke there, so kidney there.
Say kidneys. Latent syphilis infection can cause glomerulopathy. So GGF we can was in glomerular filtration here and I say structure na a filter emoji and more need to me saying. Young guy or need any underlying condition be on your hypertensive and can be you've been hypertensive for so long and I say oh diabetics for 20 years sometimes it's obvious after 20 years 25 years of being a diabetic the next thing is your kidney starts more functioning and see that's why we do the treatment alongside oh yeah metformin oh yeah other downhills now we check it oh yeah renal functions because a doctor said that the kidneys will fail and you see what there banning na functions no kidney renal function test we sa obi unknown diabetes can do unknown hypertensive medicine yet none the kidneys say ubu say a dentia ube kobe reactive
syphilis in so area born in papa now dog and what can say the transmission no na if he pan ever
infections there
yes my whole transmission umpo about me afa baby about you want protect you know and see the best way is to wear condom right
yes.
Okay
yes.
And know you're 100% you are
barrier,
covered
barrier contraceptive
and no crap one shey na wo hwie na one hwie ni ya
yes
About go.
That's it.
Now kobotoku na korra.
Barrier contraceptives. That is the best thing. Abstinence. Abstinence. Staying with one partner. Staying with one partner. I had a client. Now, tested positive to chlamydia. And one day we'll delve into that one.
Okay.
Chlamydia. Where Papa you very noble, rich. See, or the career lapse no baby. No, the results in the buy. And I'm was say opposite or the veteran. I mean, me no. I mean, what is in the report? Intimation. So this is the reason. There's an infection, chlamydia infection. However, he has to bring Nere. Unim the other buy.
The girlfriend.
I was like, because me share the man and the lady now didn't buy and well, of course, mean to me me treat so I treated them for some time. So lady nankasa and perm said unim say asumesi onye mikunu ne yankasa on some poucho convince him
to bring the wife.
I appreciate the fact that he has brought me and both of us.
So on himself, banana and treaty, still a bit brand.
Because Berman, the ordinary one another, or their man, but because on no said be or your bad penny near the intino, on whom is to be a harness to say. But one hour younger all the time, said be Owusu, intino or the waba. So it's like, oh, please convince my man to bring the wife so that I'm a yemi and sending
treatment.
You bet me any treatment. It's a car. I could say Obiba na or ye positive to any infections. On try say ordinary partners. I had a call. I think the last time I'm say hepatitis B. But one gentleman called me, said my girlfriend tested positive to hepatitis B, and only the opposite Ojai girl. Can you imagine this one?
No person Ojai girl. It's in
and I'm say and to say Ojai na say be unko for Obana. Sa Obana okofana unim the ono say one. So we are lucky enough. Your girlfriend told you say what tested positive to hepatitis B, and to they also got tested. There's a negative one. There's a vaccine. Hepatitis B is not a death sentence. So therefore, my you to be an answer your fiancé on your no profile on your viral load na yehu kwanya. This be many guy no kasai cancel na and they are still together. Even though you buy and minim so be jana dia because say about 3 weeks ago say in a year program. Minim because be man so the onya kaso be jawo de be jawo.
True mo tan abako. Onja o ye po ehun ano na oja.
Ani ya go pon. Enti empe bebre no o partner bi wo infection enye se oja no nem support.
And the dog in short not just say syphilis na ye kin. Empemu agro na de be. One hwe ni year, one treat ni year. A bit me and yes say one no na be okro keke. And now I see be na be okro keke. It's me affect your body inside. Na ekọ wa dream. E ma wo bodam.
We had even a case pregnant woman. And a bano or one say but to say kokromuti say. What say nipa me trade say syphilis na yen sa.
Syphilis na ya kola na
yes. Undeveloped fetal weight and a fetus. So what say your bar now was syphilis when treat here. When you ma abofrano onyi.
Hey. And I go any idea then the agro salon.
It's not we say as time you read. People have done research, good papers on it. Abofrani ni and for me
your bar
now syphilis. Now when you more abofrani da yim onyi there be over one of the secretary. say uti so ye na wo no so a ana say uti ye na wo nyi so a onye dey untimi ngo no ana obe na wo akran bu wo yam still bet this a chow ni ye akala
syphilis it's that into the didi agrosa
oh say you fe ni agro e can one of the mandated maternity labs no
say no the maternity na normal life no way
say also no say they would kan say you proactive and before anko back obe planning into family obe wa just okay say ope so fanyisen na wo nka wan kasa kra di kan so di kan eye we no screen
Abusa 03022435547 03022435547 and 03022435529 F2 phone lines are activate upesa ubisa doctor question fa sa impemwa grodi yare ubesimi afre sa number no 03022435547 03022435547 and 03022435529 alternatively ubetimi asend a voice note and WhatsApp message afa 059 620 0902 059 620 0902 ubetimi the message na afa ho na Dr. Abuao dog obi say you're diagnosing with syphilis about 2 years ago.
Okay.
Or your treatment no but onim
osanko ebio je say kwa because me nim ne de no either say early infections and are latent if it was early infections thank God a bit me akọ but or mo ye mistake back why na omo ye no wo ko na ya ye no treatment and ya diagnosing no any treatment on sanko bio
they be say akọ said their doctor na kind no why
no, please go for a review. That's why we give a review date. Now if we say man na say be here this and my date no.
So kwa doctor baka say ko lab bio.
So 100 cedis. Any abodam dey na pay. Have you seen?
Serious so.
100 cedis.
Agro ade you 2 minutes agro di. Na dey be show on for years. Now each one hwe ni na ma wa akobodam.
Obe yes so just paranoid. What ho ha? Ebeka so bi di wachi. Gentleman be the parents in the buy. Ono ne papa ne mama nyina wo one apartment. O say ono nko a ne room ne roof ne so no. Cross ebesisi so. Yes. Anene emo na omo ko mu. Omo na wo fie ho.
Enyo no nkwa na ti.
Enyo no nkwa na ti fie ho.
Enyo no nkwa na ti dede no.
Ono nkwa na ti dede no. O ye se wo ha na ohu a no di watem. Anoma bia be kan ho asem a kire. We di watem san ti ne ma me de
syphilis ya na
psychiatric medicine. But onye gidi onye obi a na nusu ye gidi ana so ye violence so. But obi pay healthy so me yes if it's not reactive. So.
And I will test the VDRL.
That's it.
And to collab bia but who cut Lancet amount specific
amount quantities blood no what do
and no you didn't juice on amoja na and ombechu moja kakra na bebe
ombechu moja
kakra na bebe
kakra bia be
omwade no mo tweno
say 2cc to 5cc yes e bit me atwen no na yakatro say bia ko be a week time
no abeje I take it time
but it will rapid test kits but some of them they are not
it's just a rapid amount details
exactly
and so yeah okona twimoja na ye ma odia no say wunya detail results
exactly
ebusia me no wan ga start years I was say me Lancet for no kra na me bi so mo say test na ya he
yes yeah and bit me abo pa we are researching here probably bit me that can one of the public health
education because I didn't able to am a stroke as I'm a bodam dia say I was say to an amount should be the akofa kidney problem ya be
kidney problems a man of neuropathic disorders the nerve no ewu the nine no on uti the nine on ti it's not the boba no aboso and until the 90 funny the ewu
on ti
so until we no say e dey affect sa dancing no nanka the form na ewu no once I feel on to me and feeling bia now another thing na nanka be we feel muscular atrophy. I say baby my man complaining in me bear me phone me bear me yes syphilis could cause your because the bear man is made up of muscles, nerves and blood vessels. So what I say it is a unya sa meningovascular na
muscles ni na
to be able to say quiet chinchine quiet kitikiti we define we've been having them doctor me define me ye bibia fan but me nyekesi we video we go say reactive so go say be my kitikiti if we want energy drinks emba until say ya solve it that problem
nyame hu ya mobo nyame asam wo ebusiafo nanso draw ho doctor say draw ho entutu ho na montema obetumi esiano ntem ntimpamcho yenye hu ye idie me bacho yembo modian se nyina me ne wanka unim pose bi wo ho a na wakoye test na ntem na wa check say ebi wo ho dog o contact na yeden
0243 768
0 2 4 3 7 7 6 8 8 2 biom 1 6 but
0243 768 216 33
okay
and 433 that's it 0243 768 216 yes
it was doctor contact ni so bibi chire wa adwen to de bia menum say nyama ni bi wo ho a when we go details say dia mo pese mu ye no one on one doctor said ni mu esi ho amamo ntimpam cho mo betimi afre no dog na test no ye bi wo ye bi wo ntimpam cho mo betimi menyanka no obi akran ko test ne de because they are dey bubokoyi actually say it could be a cause of a lot of things. Because one time I was reading something about kidney disease, outside the hypertension and then diabetes, you know. Me so much sure infections, but they were not specific
infections.
They were not specific. So it could be part of the infections.
Yes. So the infections we group them. So we have the STIs and then the UTIs.
Okay.
Yes, and both of them could cause kidney disease
because na ye kind of na make us so media no unknown hypertension na me Mr. Ebusiana hypertension na no be so need the doctor see the diabetes and then there was this other person also need the same infection but man code details they be me Ebusiana man from bia man code details and see it could be what I say why we need hypertension we need diabetes na fe agro 2 minutes to be keke na kokukuri ya ama
abi the with the ones that's omo kidneys no I say by probably syphilis no syphilis no say you dey can say there's one meningovascular so vessels no on say black
carry moja no
na yen kidneys ne so moja efa mu nyina ekokofa nti say wo infections no ana so syphilis no ewura won sunu mu ena emoa no koye because say moja no e wo say di kan ko kidneys mu na say bia emoa no dru wo sa blood vessels bi ekita kidneys no yie eno no e ho na e de problem ne ba nti etimi essay ebubu and I say a creti a crew ho na ma the very strictures growth aba a hobos aba nti bon say if a moja ntimi nko kidneys no mu bio and say we deprive a moja na say kidneys na wo hunu sa no say moja ntimi ankomu some few minutes it will lead to aki. Aki means acute kidney injury. So I say, and see, kakra, sometimes a be acute. Yeah, scan. Near who say, sir, blood vessel no, was stenosis, and I say a blockage, and no surgery. We do surgery to patent the blood vessel. The more jet me oh you oh la la. Oh you free.
Okay.
Oh you okay.
Yeah, now Kodia.
Yeah, now Kodia. Then, not just say bakwa, kidney bakwa say no. So you're living on only one. And sometimes they are na ya and one was say, and Pembe Boma who say kidneys nice and yana bakwa said da. Bakwa the can't say da and
I mean she shame Baku bet me age when you bow on son.
And son Abia won't say because I had a case tapa. The man came with hypertension and offending no rights. And to only the or say hypertension known on pese or benum bebre.
Or better be affecting in the bema.
Exactly. And you know of the son of a source son Nanka Onya BB natural.
Local.
Exactly. No, not natural.
Natural.
And Obaya may ye EGFR no. And I mean who I may arenas. Yeah, we now functions and I'm who say EGFR 63. And I'm catching so since I any nothing or buy me I'll concentrate on the or the buy cholesterol was high. There was some fats around the because now liver enzymes no I was through. It's me the my back cry me ye me join my hand of him so doctor. William said they were kind me nya severe back pain. Ama ye de me akọ Cape Coast interbetter am yaka say me kidneys no back as you abi papa ni twa picture chere me nsu a ye drain free the right kidneys no say paint ketwa no ma back they were
it is a Johnson was sank a pin in our time
and he was shocked and decided no when time I said well for me sometimes even though I could go overboard, like I think outside the box, but then I try to stick to what patient brings and as a client, But we all because I'm a private practitioner, obviously be an seeker.
Yeah, and our page.
But the culture will say kidneys no functions not yet acceptable with the range in our world. Yes, doctor, okay. And Oba Kulebu or call Confanochi because the surgeons were contemplating saying Umbi kidneys in back on their names you know only saying Kumbi Yefio. And one surgeon and Usiano Cape Coast or yes Umbi to me Adrian and tuition if you say Yapayo trying to say pictures are or the Sunday man you chat the young say Aqua kidneys no Adrian shooting as I say Namiadoma or recover. So yeah, the last I'll call in the winners now EGFR for 73. And see the year can you say you're proactive. Media I believe in the wellness clinic and over the year, the whole of this year, I've been talking about wellness. And then see now mama my year package a laboratory package over 18 years to 35 years, there are certain labs I also have brought me once.
Okay.
No. Nka wo ya uncle so.
Ma dear na mema dear. Okay.
No, we are 18 years to 35 years. Utia 400 Ghana cedis.
Okay.
At least I could do 8 different kinds of labs.
Oba. Okay.
Meet me
ebini den
syphilis womb.
Okay.
Chlamydia womb.
Okay.
Hepatitis B.
Not just sexually transmitted diseases.
Because
the problem no. Yeah.
18 to 35.
Yes, it's true.
Yes. Now from 35 years to 55 years, and also my lab test, my 10, which are 800 pay.
Okay.
and no renal function test room. There's a test called HbA1c. I know you know this.
Yeah.
Because we've been doing. You
Yes.
do it.
I've done it
yes,
before. Yeah.
Yes. This one is glycated hemoglobin. It detects or it tells you in the next 3 months how well your sugar is doing in percentage wise. Unlike the yawa on sano.
Where trimoja?
I know the millimoles.
Okay.
Yawa on sano. You have millimoles. But your trimoja no has a year. Your glycated hemoglobin. You have the percentage. And you shouldn't be more than 4.0 to 6.0% normal. See, we are 35 years to 55.
Oh, say check him out. Okay.
Now, we are 60 years, and also your lab test, Makuma 14. We enjoy 1,000 pay. So, this is what
into a package.
My package.
And I remember the same.
Yes.
18 years. 400.
Yes.
And
we are
35 to 55 now, and we 800. Okay.
And now 60 years and above. And we 1,000.
And only panel was so bored, so you are now over corner.
I was so we were executives.
Okay.
Now they make home 100,000.
Okay. I hope I say about what they are, over to your transportation account. Okay. A be 100%, a bomb whole fee. And see, say a organization be cry now, sorry, been a more organizer now, a busier and I'm more organized by say about checking maybe a Sunday, Saturday, Saturday no be our fear. I'm more frail, back. Okay.
And on me, and name is Ness,
and my lab tech. Okay.
You check your vitals first.
Okay.
And Sana, may not be doing Komokaka, and Sana lab technician. I take you sample.
I think the way to healthcare is wellness.
That is the best.
Is the family clinic stuff.
Nah.
Our kwabi be our honor. Yeah.
And then Europeans know who am I or more decant. I live in Germany for some few months. And Nipana Menenetino. Every 3 months, Obi in a box na letter will say umbra checkup. Said the date now the also they call checkup. No one call no so much me fine on Ocheska.
Messi, I Jimmy card the crave for me, because I was supposed to go in May. Manko 2-3 calls to be cry. Ya trouble letter. See ya Jimmy card.
And I wish we could replicate
the same here.
Would they yen to me in full import? Yenya kakra, at least with the senior citizens. I wish one insurance company be to me ISRD way. So what I say enya compulsory quarterly. There are some specific labs are compulsory and mandated say in Ipabe. At least in Renas. Cholesterol. Only say cholesterol say one of the silent dangerous disease.
Exactly. It is.
So and then with this men in PSA prostate specific antigens yama almost
and also say
and also one of the thing I reward to abusiemu baby. But what you for no wine?
I just for name and no Saturday way at Traha year bonkomo at Chagana for say I was so on more pumuding and you will hear some.
So this is what we've been done, or we've been doing. So the whole of this year started January.
Okay.
And gradually
pick up
wellness, Dr. Mete say we labs to be it's okay 55 years, so you're old here 800 or 60 years, and no matter needing senior citizen, and you're 1,000 cities, we lab test 14. We are to your boss at church. The here drew yen running now so natural yen running natural. I be there one medication I wish think I'll be a bit to me a nebi obemana ko na duanim a supplement I'll be to me a man a ko duanim on same pembe meaning baby or munya aside to officer sadi huns you enye meboa also gon say only pan diabetic or hypertensive or this side no we you nego.
It's normal in most homes. Yeah.
You know, ekita omega 3 mpacho.
Insuno omu ninyina. Ninyina.
Ninyina to pekwa the menu nam now dey.
Yeah, ninyina.
Ninyina.
Some say a cho konko no mu INC.
Oh. So that's why it has expiring date. So, expiring quantity.
Expiring quantity.
The active ingredients is still there.
Mm.
Eat it. And see, alpha, and no be ufa, a bit me abwao. We are diabetic. We are hypertensive. Zinc, idea, and also one mema. And he, BBA, zinc, now I'm watching Yakoso. Now I'm funny. Vitamin E. Vitamin E. You know all these things.
But dog who come but see me make comment.
Oh, with your story, with where you come from. So what kind of moment you
dog almost me hard drink.
Oh,
obi crack catch him so work a cra ni pebe wunti. Mr. Rampesa mo dodgy owu no. Obi kind.
So tell them you are I mean, it's not like you are stopping them from dying, but
omu didn't know who me no mu jane. Don't me of I don't know.
I think you might be one of the source of inspiration to them. Obey some monuments. That's why me who are the Bianamania. I told you. I share with Otavia. Meaning so catcher was it. Abigail is my kind of obia. A mama just say medicine. Yes. Yeah. We obia. Who am sure. A mama just say medicine anymore. Na me drink of war, me preventing of war. Because doctors we don't stop dying, but then we prevent it. So
it's true.
Obi. But then say who doctor and tell me. Think I'll be when now. If you are bit matter.
Yeah.
1 year account.
It's true.
And now 2 years account.
It's true.
And go for be a me job hoba, me ba program me job hoba. When the nurse tie, or yes so week near idea. After we gave iron sucrose with some few normal saline. Then he told the mother say
to me home. Yeah.
So I tell but my no, it's so indeed.
So to me did yeah, some more dog.
So did you now
I believe no only the me then I say first people were not so much interested in nutrition. But I believe as time goes on people are becoming very careful. Now they know they are making healthy choices. They are making and a pass some more tough fruits and vegetables. Sometimes our mom feel say, oh, they I mean, they don't get a chance for this refined food, baby.
Okay.
But almost so many
Dog. Almost they are in different world.
I swear. I swear. It's been interesting having you in the studio this afternoon. We spoke Busia, Yakasafa Neurosyphilis. My name is one Tisha Cra. What to say? Chifrimuno. No. Chifrimuno. Chifrimuno no one triangu. I better will be a friend. Now do go about no two and another one. I
like that part.
It's me botokro. Syphilis no say money be what sperm na ba mu a. It's me botokro e ko ro ba ni mu. It's mpamocho. O your ba or the ba pacho pion free or what? Pe ho asema mu use condom. Na fa bon ho ban. At least that's the best. You see Jaina wun Jaya use condom. Makami die. Don't pacho bo number ni biom so be here one non for why.
Number is 0243 768 216. Go for refer.
Pacho page why? Or make us my number no move and
0243 768 216.
Okay. Dog number no so our WhatsApp and to me pacho oh fret no on fire. If you know another call no meeting be call WhatsApp now send me WhatsApp message me pacho later. Or the lensa we your voice note to cry. We your voice note he will respond to you. Me da say dog no be person about how we see no one fa. Kaneshi
baby metro masses no mo load
Winneba ni Cape Coast station ho.
Baby kwano ho na Pentecost Junction Pentecost Junction ho na.
Okay.
We do abuhu
Sambod Healthy So Medical Center.
Monday to Fridays. And then Saturdays no you pon 2 o'clock. Saturday juma 18 upon 2. Monday to Friday you pon 5 o'clock. Your packages ni na ye juma.
Me pacho.
Onye labs and why labs no on ti ase.
The fabra you bet you mama.
Abi man be fake tema buy. Oye the labs ni na nti EGFR no. First one oye back no 49. Or 42. No 46. But unim say onim about o ma start man ndo but
onim ade kura ye no ense ye man edro
so ba na me che ne se ade we nti
na ye ma we na won bisa
abi uni ho akaka
Udia Peja for Dr. Owusu Ansah, medical practitioner and CEO for Healthy Soul Medical Center. Ebusia or one crying ha. Uko Kaneshi, baby a fat Cape Coast car, any Winnie Baka, baby a Metro Mass for no one, me patcho a hot and none a see and ewo obet me alcohol. And now obet me a friend, ewa 0244 5595. No, me bo be number. Me am me bo number me won senya ne de na. Okay. Obeti me afre doctor one number na or de my no. Dog my church number 02 okay, me hu dog there. 0243 76 8216 0243 76 8216 me patch doctor number you no kasa ne personal number obetumi afre no and now obetumi send WhatsApp voice note and now WhatsApp message na patch obeboa obetumi akona so e ho so a na wako number ni biom 0243 76 8216 yeda munyina se bebre se ne munya time a mudi etie me patch ya wodie na nyankopon so enye ne de emfa emboa what I say me da munyina se da se ne ye be hye biom me din di Abigail Ashley numunsuo didiyie deyie numunsuo didiyie deyie na bo wase ho ban what I say me pacho untumi nya hwe kra me pacho doctor say syphilis no oye wadwen se wo dodge ono so be dodge tufrumu entumi save life nti mpacho condom na fa bon ozu nja dia she condom na fa bon ba na echiwa etumi mani pa bodam nti mpacho hwe ho siye wate nyame nka ye ho na mboa ye ewo ya nam a ye ba betu nyina ewo asase su